So, what kind of patients, and cases approach gynecologist versus obstetrics?
Generally, a obstetrician mainly come across a normal low-risk pregnant patients, which we have to guide her to her pregnancy in terms of dietary requirement.
From the miracle of the childbirth to the science of women's health, today we are going to step into this fascinating world of gynecology and obstetrics with Dr. Manisha Kulkarni, who is a dedicated and an experienced gynecologist and an obstetrics specialist with a very rich background in both Indian and UK healthcare systems. She is an MBBS and a DNB in OBG and MRCOG1, which is a membership of the Royal College of Obstetricians and Gynecologists, UK. So let's welcome Dr. Manisha Kulkarni.
Hi,
Thank you
thank
so
you.
much for joining us.
Thank you so much, dear, for inviting me for this session.
Totally a pleasure.
Yeah.
So, Doctor, I want to start the conversation by asking you what is the difference between gynecology and an obstetrics?
So, gynecology and obstetrics almost both are the same. If you see as such, they deal with a woman
Hmm.
since the adolescence age group till the menopausal age group. But to be more precise, obstetrics deals with a journey of a woman since conception till she delivers and post delivery, at least till 6 months post delivery, and all the medical problems which a woman has to face during the pregnancy and post delivery, during labor as well. The obstetrics is mainly involved, so they manage both the obstetric problems related to pregnancy and the medical problems as well, and we call it as high risk pregnancy. Okay, but whereas a gynecology is completely concerned to the reproductive system of a female, and they are more concerned with into the periods of a woman, how it is normal or abnormal, any pelvic infections like any vaginal discharge or any infections into the reproductive tract. And also it also deals with a woman who is unable to conceive, if there is any surgical cause which is causing her not to conceive, like for example any PCOD issues or any cyst in the ovaries or any endometriosis problem, then a gynecologist will do surgical procedure in order to help the chances of conceiving for that woman. And not only this, there are other subspecialties in gynecology as well,
So we'll come
which
to that. We'll come
yes,
to
yes,
that.
yeah.
Okay, so what kind of patients, and cases approach gynecologist versus obstetrics? If you can throw some light on this and give us
Yeah.
a little more elaborate
Mhm.
details on the two.
Okay. So, in terms of cases which we see on day-to-day practice, generally a obstetrician mainly come across a normal low-risk pregnant patients, which we have to guide her to her pregnancy in terms of dietary requirement, what nutrition is appropriate for her, and how to maintain a active lifestyle in pregnancy, and the scanning aspect. We have to do scans, regular scans, growth monitoring for the baby, and ensure the baby is growing well and mother is also good, and decide for the date of delivery. This
Hmm.
is a low risk, but whereas in high risk pregnancies, it has got some added risk factor. That's why it is called high risk. Like a woman can be having any medical problems like diabetes in pregnancy, thyroid in pregnancy, any autoimmune conditions like SLE, rheumatoid arthritis, or a woman can be having cardiac problems, any respiratory problems. So, any medical problems will bring her to the high risk. So, we have to manage her medical conditions and also to the baby. So we have to manage the two lives in the same setting.
Hmm.
Whereas in gynecology, as I said you earlier, we will look into the different gynae causes like fibroids in pregnancy, endometriosis in pregnancy, adenomyosis. These are the pathological conditions related to the uterus and to the ovary, and any concerns in the cervix and vagina will be dealt by the gynecologist.
Okay, very well explained. Thank you so much.
Okay.
So, is it common for a doctor to specialize both in gynecology and obstetrics, or do you usually specialize in one? Like you pick and choose one, or do you specialize in both? What is a common practice?
Yeah, I personally specialize in both the things. I have recently done my fellowship in laparoscopy as well, and I have been trained in laparoscopy in UK. So I would like to practice both obstetrics and gynecology. And if I am not able to manage certain conditions in gynae, I would refer such patients to my senior colleague who can operate on such patients. So all over the world, most of the OB/GYN doctors, they practice both obstetrics and gynecology. But when you reach to certain age, you would give more preference to your lifestyle and your family. So you curtail your specialization for that. So you would sub-specialize in certain things like infertility or in laparoscopy so that you have your well-organized day. You know when you get handle emergencies, and you have elective procedures only for gynae. Emergencies come very rarely. So people opt later on to the specialty where the emergencies are very less so that they can have good healthy lifestyle as the age progresses.
Oh, that's nice to know that there is a progression and switch over that one can make in this specialization to
Yes.
strike a work-life balance.
Yeah, not only that, nowadays, a newer generation, I can see my young juniors, they are very much made up their mind that I am not going to take up obstetrics because I can't handle the stress. I can't handle the unpredictable hours of emergencies. And hence, I want something like infertility, or I want something like imaging, fetal imaging studies. So these are the subspecialties they choose from the start, and they keep on doing that throughout their lifestyle, throughout their life, sorry, so that they can maintain healthy personal life and the professional life as well.
Okay. So, what is a typical academic training one needs to go through if they want to become a gynecologist or an obstetrics? Like, what do you do after pursuing your MBBS? What is the path like?
So after MBBS, basically, if you have done MBBS from India, you need to go through NET PG entrance exam, which is the preliminary exam, board exam conducted by the government, and you have to excel in that exam so that you can perceive the specialty of interest you are in. Whereas in UK, the system is little different. In UK, as soon as you finish your A grades, that A levels, you directly enter into the medical school. Okay, and then you do the F1, F2 training, that is foundation training, you call it as, and then there will be the 7 years of specialty training. Whereas in US, you have to give the USMLE exam, step 1 and step 2, in order to enter the training for the specialty you are interested in.
So in India, you have to first pursue MBBS after
Yes.
12th, right? You
Yes.
prepare, you take your NEET UG examination, you need to
Yes.
crack it in order to get through an MBBS institute in India. And then after that, like you said, you need to go for a NEET PG.
Yes. Not only NEET PG, just to add on further, there is other entrance exams like DNB exams as well, okay, which is also conducted on the national wide. It is a national exam. So you have to clear even those exams. Once you clear the DNB exam, you have to apply to institutions where the DNB is provided. And then you have to attend the interviews conducted by those institutions. And once you are excelled in that interview, they will call you upon the grading system. Like if you have got a higher number in the interview, selected in the first mark, then you will be prioritized for that institution. Both are equivalent in India. DNB, MD, OMS, both are equivalent PG degrees, and they are both 3 years training program.
Okay.
Yeah.
So you can either go for NEET PG or you can go for the DNB national exam.
DNB entrance exams, yeah.
All right. And they are equally at par.
Yes, they are equally apart. And in terms of the final exam, MDMS and the final exam for the MD award or degree is conducted by the medical colleges. And for DNB, wherever the hospitals are providing, corporate hospitals and all, the national board will conduct the exams at the national level.
Oh.
So you have to go wherever the interview slots are given to you for the exam. So you have to enter for your Viva question exams in person and go to that institution, give that exam, Viva, and then you have to wait for your result. And this is national. Wherever you get, you have to go there.
However, the medicine education training is quite different in US.
Yeah.
So you cannot directly, you need to have there's a requirement of pre-med, if I'm not wrong.
Yes.
So can you please, for the benefit of our audience, can you please enlighten us on what is pre-med and what is the process like to pursue, say, a specialization into gynec and obstetrics if you are planning to do it from US?
Sure. So if you're planning to US, if you're going to that route way, that is a bit longer. It will take at least 14 years of your training if you want to persuade your career goals to the US life. Okay. And I would recommend this if you are planning to settle over there. Thus, it is all the more worth investing in that since your start. So, as you rightly said, you need to do first 4 years of some pre-medical schooling exams, that is certain subjects like biochemistry, physics, and science. These are the prerequisite which you have to do at least for 4 years. After that, you have to give MCAT exams. And once you excel, you have got 4 years of medical schooling again for the US. And after that, you have to apply get into the training, which you need to apply. And that again will around 7 years. Yes. So it is a bit lengthier process. And as you go into the training, you will be trained in all the areas. Okay. And then you can again sub-specialize, as I said, in whatever you are interested in, that is at the end of those years.
Okay. Whereas in UK, the academic training is quite similar to the one followed in India, right?
Yes. Almost similar, but it is a bit lengthier when compared to India. So on the whole, if I tell you, the shortest training is in India. Okay. But in India, you will have OBGYN basic training of 3 years. Following that, a candidate will go into fellowship training, which is all the more maximum it is 18 months or 2 years fellowship. And then if they are interested in that particular fellowship program only, then they will they will get into that specialty only in the later part of their life. In UK, you have to, after the A levels, that is, after finishing your 12th standard, you can directly enter into the medical schooling, which is around 4 to 5 years. Following that, you can directly get into the foundation training, that is for the period of 2 years, that is F1 and F2.
Okay.
And once you finish this training, you can apply for the specialty training. Like, for example, if I'm interested in gynae, I will apply for gynae. And there is a ST1, ST2, ST3 till ST7, which is specialty training programs every year. And this is 7 years program. Once you finish this, you are a consultant in UK. And it's more easier if you have done your A levels and get into the pathway in UK. It's easy to consultant level. For example, a candidate like me, for example, I should say, I have finished my training from here and I have entered to the UK after my post-graduation, that is my training in Obs and Gynae of 3 years here. So to enter into the training in UK, either I have to give my PLAB exams, that is I need to be get GMC registered, that is General Medical Council of UK. I need to get registered to that in order to work. You can give your PLAB exams and go that route. Or since I have done already my OBGYN here, I can either do MRCOG exam, finish all the 3 parts, which is the most prestigious degree all over the world, okay, and then get into the training. So training directly you can step at ST3 level.
How does an MBBS doctor, like once you have completed your MBBS, how does one decide which is the right specialization for me and whether gynecology and obstetrics is suited for me or not? Or is it only or mostly chosen by women?
So after your medical schooling, I mean, during your MBBS, you will be having a internship. Like you will be put on the hospital side internship, like for a few months. Rotation you will be having at the end of MBBS. Okay, so you will be in the medical, you will be in the surgical few months, OBGYN few months, dermatology, all the departments you will be rotated. It's an internship, we call it as. During your internship, your heart will tell that, oh, I like this specialty, I like dermatology, it's so cool just sitting and seeing and all, okay, not much hectic night duties, just 9 to 5 job, and you will have your personal life as well, family life, okay. And if you want to do apart from medical schooling any other side business, that specialties will help you, ophthalmology or dermatology, that specialties will help you. But other clinical specialties like medicine, surgical, OBGYN needs a lot of commitment. Okay. And it has got a lot of unpredictable hours, a lot of stress, and a lot of clinical commitment as well. Okay. And a lot of hard work is involved in that. And you should be emotionally very resilience is needed for such specialities, where you can manage the stress at home, where you can able to manage the stress at hospital as well, and you can excel in whatever you are doing. So if you think you are okay to take that stress, you can take up the surgical part. Okay. But leaving these emotions aside, once you are into the internship, you will know what you are interested in. But if you think you are really interested in something, please choose it. Once you are into the training, your body itself will train you for that. How to emotionally resilience, how to handle the stress, how to show the leadership qualities when you are at certain stage. That profession will show you at the later stage. You will learn it eventually.
So actually, this brings me to my next question. What are the key qualities or skill sets which are very, very important to have, if you to have for a student to figure out whether he's well suited for a specialization of a gynecology and an obstetrics?
Okay. So in India, some students, they will be having a background of their parents who are already doctors, who have got all set up.
Yeah.
You think you have got good setup, and if you think you are interested in that specialty, please choose it, because you have got your strong support of your family from background. Okay. And for the students who don't have any support, or you don't have any family background of any doctors, you choose a specialty what you are interested in.
Yeah, but
Okay.
what do you think are the key skill sets which are
Key skill
required for
sets.
gynecology and obstetrics?
Key skill sets is that if you are very hardworking, if you can manage the stress, and if you are committed for studying and working for a long many years, okay, and if you don't have any family pressure of any marriage or anything, any other commitments from pressing you, and if you can work for longer hours, you can take up any emergency calls at any time of the day, you won't get stressed up easily, then you can take up the surgical aspects, okay, like orthopedics or surgical branch, general surgery or OBGYN. If you think your personality is something which you are not able to handle the stress, or you can't come to you need to come can't take up the stress, or you can't manage, or how to handle the stress you can't are you're not able to do it, or if you for if any stress or if any problem solving mechanism is very important. So if you are not able to get into the problem solving mechanisms, then you need to take up a branch which is bit on the lighter aspect, like a dermatology or ophthalmology or any other branches where you, or a GP, general practitioner, where you work as family medicine doctor, where you work only as an OPD. You just see the outpatient department patients and you work from 9 to 5.
All right. So now coming back to the subspecialties under gynecology and obstetrics. Now there's like a wide array of subspecialties,
Yes.
within this specialization. So if you can, mention all the subspecialties that exist.
Sure. So in obstetrics, you will be having a fetal medicine specialty where you only do the scannings for the baby from the start of the pregnancy, all throughout the pregnancy, growth scans, anomaly scans in the baby, or the stage 1 scans. Everything is done by the fetal medicine doctors. So you subspecialize only in that, which is only to 2 years training in in India. Whereas in UK, you can opt for subspecialty at end of your specialty training, that is at ST6 and ST7 level. Okay, so for those 2 years you will be just involved in that, and then you can apply for the consultancy. And then you have infertility as well, okay, where you work on how to get pregnant, how to get a woman pregnant. And there it involves a lot of medications, a lot of procedures like laparoscopy or hysteroscopy, where you have to do, where you have to learn certain skills apart from the infertility fellowship, like you need to have some basic laparoscopy and hysteroscopy training into that. Okay, and a gynecology can also do and subspecialize in a endoscopy only, like they do only the laparoscopy, mainly the surgical aspects. They own benign conditions in the fibroids or any endometriosis, adenomyosis, such things, or hysteroscopy, any polyps or any cervical causes. They deal such things. We call as a minimal invasive surgeries, which also include robotic surgery. So there is a fellowship even for the laparoscopy, there is fellowship even for the robotics as well, which is almost 2 years of each here in India. Okay. And whereas other specialities, like if you just want to do a benign gynae, only OPDs, and just refer for surgery others, some doctors even do that because of the family pressure or any other commitments. They just do the outpatient obstetrics and gynae and refer for the delivery or surgeries elsewhere. Somebody else will do it. And the other thing is oncology. If you are interested in the cancers, if you are interested in oncology, you can take up the gynae oncology and just specialize in gynae oncology. And that is more relaxing branch, I should say. But some things it will be very depressing as well, looking at the onco patient. So it all depends on what you are really interested in.
So, like you mentioned, the obstetrics is a more challenging specialization than gynae.
Yes.
I'm not wrong. So,
Yeah.
what motivates uh, someone to go in and specialize and have that, round the clock kind of a hectic work schedule, for getting into obstetrics, than a slightly easier one like gynae or maybe a dermatology or whatever other specialization? So, what motivates
Yeah.
what
Yeah.
motivated you, because you also have dealt with
Yes.
erratic schedule? So what
Yeah.
motivates a person, to get into that kind of a grueling specialization?
Sure. So I have chosen most of my part as obstetrics, and benign gynae, where I handle the benign gynae conditions and contraceptions and adolescent gynecology. So I have done my training in UK. So I can handle the high risk patients very well. I can manage the medical conditions very well because I had my after my MBBS, I had worked in medicine where I can handle the medical problems in pregnancy. While in UK, I was there in the outpatient clinics and all. I can manage the medical problems of the obstetrics. So I have chosen obstetrics because I can manage the medical problems and the obstetric problems where I don't have to refer for the medical problems to the physician. We can what do you say, run the OPD managing both the specialties, medical
Wow.
and the obstetrics as well. And you can see the benign gynae problems, adolescent, perimenopausal, postmenopausal as well. Okay. And whereas gynae, it involves good hand to eye coordination, good muscle strength, and you need to be committed for the longer surgeries. Sometimes not all the surgeries are straightforward. You need to have that stamina to stand, hold the scope, operate, and have that stability in operating while for the longer duration of surgery. Okay, so if you are committed to that and if you are okay to do that whole life, even though if you are aging as well, some doctors, like I have seen most of my seniors, they don't prefer longer surgeries, longer standing and all.
But
So
is it
at
also
certain point,
because of high compensation and the remuneration that you get
uh,
when you are in a more demanding specialization?
yeah. So the other thing is that because it involves longer standing and all,
Mm-hmm.
Urogyne you can operate while sitting. You don't have to stand for longer duration. Okay, so most of them change their branch from the gynae to the urogynecology as well, where they only handle the urogyne problems related to the bladder and postmenopausal laxity of the uterus, a vaginal wall, and
Mm-hmm.
reconstructing of the vaginal wall down. Nowadays, it has come cosmetic gynecology. It is a newer branch which has come since 3 to 4 years now, I should say, and most are just specializing only in that urogyne and cosmetic gynecology, where they don't like a longer standing hours or they just want restricted time and they just want to do elective procedures, don't want to handle any emergencies.
So
And
what are the
in
yeah,
terms of pay, if you say,
yeah, I was
both
just coming to that. Yeah.
both are paid equally.
Oh,
Okay.
is it?
And if
Okay.
you want to handle more stress,
Mm-hmm.
longer hours and do that, that's up to you because you're interested in doing that. Okay, if you're really interested in doing a gynae, if you're really interested in surgical field,
Mm-hmm.
you can do that. And for every surgery you will get some cuts from every what do you say, every case you post to a corporate hospital, especially not the government setup. But
Mm-hmm.
doctor fees will be there, but it's very very minimal, I should say.
Okay.
Okay, that doesn't add on anything. But if you have had any UK specialization,
Mm-hmm.
or if you have any US, like if you have done MRCOG, or if you have got the CCT, core completion training from UK, okay, that ST2 to ST1 to ST7, if you have done the training in UK and when if you want to come back here, that has got more added advantage in the corporate setup.
Can you explain us all these levels of ST1 till ST7?
Yeah, sure. So once you finish your foundation training in UK, that is F1 and F2, where you have been creamed, you have been taught properly about everything about the specialities, about the audits, how to do the research work as well. You have been taught by them. Okay. And then you will be choosing which specialty you want. After F1, F2, generally most of the doctors, they work for a certain period of time in certain specialities for some time. They do some locum work, like for extra pocket money, and they see how the specialty is and all in UK. And if they like really OBGYN, or if they like the surgery, general surgery, they apply for the applications for the specialty training. Whereas in OBGYN, for example, because I have worked in there, I'm going to tell you more in that only. Okay, ST1, ST2 is nothing but a basic training program, where in ST1 you will be only doing the speculum examination. You should know how to take the history of a patient, and you should know how to come to the conclusion and all. ST2, you need to do certain procedures like miscarriage, how to handle the miscarriage, how to do medical and surgical miscarriage, how to handle that. You will be giving, or you will be assisting the elective procedures in the gynae, and also for the obstetric cesarean sections or normal delivery. You need to know how to conduct a normal delivery by ST2. Certain doctors, they will be giving you the suturing technique. Like if you give a cut called episiotomy low down for the normal delivery, you should know how to suture it back. You should know how to do the instrumental deliveries. Like if a woman is undergoing normal delivery, you should know when to decide to apply the cup, that is the vacuum suction cup, to the baby's head, or when to use the forceps on the baby's head at what stage. Apart from this, we also monitor the baby's heart during labor. You should able to read how the CTG is it normal or abnormal, to make the decision, and when to take the woman for cesarean. This all will be taught at ST1, ST2, ST3 level. So ST3 level, you should have competencies signed at least for your basic cesarean sections, instrumental deliveries, and for episiotomy. ST4 level, you have to do intermediate cesarean sections, like for example, abnormal line, baby is in transverse, baby bum is down, breech, we call it as, not the head down, which is the usual position. And also you need to clear your part 2 exam. By then, MR surgery part 1 you should have cleared by ST3. And by ST4, ST5, you should aim for your MR surgery part 2 exam. And apart from that, you have got certain tick boxes, certain competencies by the Royal College of Obstetrics and Gynecology, which you have to have the tick box done by them. Apart from this, you have to show your leadership skills. You also have to do the audits at the time. You also have to do some teaching programs and get involved in the regional teaching programs and all. You need to attend certain courses which the Royal College specifies in that certain ST1, ST2 training period.
Okay.
And when you reach the ST4, ST5 level, most of the doctors, they will make up their mind which specialty they want. If you want as an obstetrics or a high risk pregnancy, you concentrate only on that, and you need certain tick boxes, more of that in that ST6, ST7 level, where you should also know how to do a scan. And the antenatal mothers, you should know the basic scans, how to do during labor, to see the position of the head, everything you will be trained in that period. And also the complex cesarean sections, like sometimes the placenta will be, because of the as number of cesareans are increasing nowadays, the placenta will be invading into the scar side. So this increases the risk for her future pregnancies. So we call it as complex pregnancies. So we call it as placenta previa if placenta is torn, accreta if it is invading the previous scar. So these pregnancies, they are at high risk, and you will be trained in UK at that ST6, ST7 levels, how to handle their patients, and you need to operate. You need to have tick boxes for those competencies if you want to become a obstetrics high risk pregnancy doctor.
So that becomes like a super specialization.
Yeah, it is a specialization. Because, and you will, after you do the ST7 consultant, when you become, you will be only practicing that obstetrics only in the high risk pregnancy. But for example, if I'm interested in benign gynae only, in ST6, ST7, I will be mostly concentrating on all benign gynae problems, like any fibroid uterus, how to manage myomectomies, and how to do open surgery gynae, how to do hysteroscopy, how to handle any pathology hysteroscopically. These all things you will be specialized in gynae. For example, if you want to do oncology, so you will be specializing in oncology only. You will be posted more in oncology cases and under the consultant who does these onco cases. And if you want infertility, there are few branches in UK, not many in infertility, I should say. That's why many of the Asian who are coming there, they come to India to get operated for infertility workups, IVF and all. because
Okay.
it is a lot of tick boxes if you want to go for IVF in UK.
Okay.
So you need to choose. If you want infertility, you have to work from ST5 level in infertility. So those 5, 6, and 7 subspecialties, ST5, 6, 7 in UK, will be concentrating you on the specialty you are interested in. Sometimes, as a woman, you will be having family pressure to marriage or anything like that, other commitments, family pressure, or you are feeling a lot of stress in this specialty training. You want some break for your life. So, most of the doctors, what they do is at ST4 level, they go into research. They do 1 to 2 years of research program where they don't bother about this training and everything. No hospital. They only go into the research. They do the research, or they go into the teaching program, into the medical schooling. They do the teaching thing for few years where they can
Okay.
concentrate on their family, and then go to the ST6, ST7.
So,
So it all depends on the individual interest. Yeah.
so MRCOG has 2 levels or 3 levels?
So MRCOG has got 3 levels. By the end of ST3, you have to do MRCOG 1, and ST4 and 5, you need to concentrate on MRCOG 2. And by the time you are in 6, you need to finish your MRCOG 3 exam.
All
Yeah.
right.
If you are trained in MBBS here and coming to the UK, you need to clear all parts before you step into the ST3 level, because the training is going to be difficult. Personally, I will tell you, and you can't study for the exam. But clearing MRCOG 2 and 3 is not a prerequisite to apply at ST3 level if you have got the PLAB. That is, you need some sort of GMC
Yeah.
registry.
Yeah. All right. And the longest academic or education training to become a gynae or an obstetrics is in US.
Yes.
So you start with the pre-med, which is 4 years or 3 years,
Yes.
and then followed by
Um,
another.
yeah, you need to give MCAT exam. Then you need to
Hmm,
do medical schooling for 4 years. And after that, you need to enter into the specialty training, what you are interested in. That is another 7 years.
that's 7 years.
Yeah. So it will take almost 13 to 14 years
Hmm.
of your life if you want to settle in US. You need to
Versus India, where you do MBBS
Then you
and
need to
then.
use USMLE step 1 and step 2 and
Mhm,
enter into the training pathways. You
mhm.
need to give step 1 and step 2 USMLE exam if you have done your MBBS here.
Okay. But
Yeah.
is MBBS considered equivalent to pre-med?
Yeah, it is considered, but
Mm.
you need to give these step 1 and step 2 exams if you
That's
want to.
those are mandatory,
These are mandatory.
and one needs to prepare for it.
Yeah. For example, you have done your training in UK and you
Mm.
want to go to US for any various reasons. You have
Mhm.
to give step 1 and step 2, USMLE exam. Once you
Uh,
clear that, again, you need to start from scratch the training over there. Whatever
okay.
training you have finished here, you have to give USMLE step 1 and step 2 and enter the training program again there. There is no shortcut.
No, but what I'm trying to understand is
Ah.
that, if you are in India and you have
Mhm.
done your MBBS from India, but
Mhm.
now you want to go to US
Ah.
and pursue your remaining medicine in US. So do you again start from pre-med level, or you give these exams that you're talking about, and
Yeah.
after giving these exams, you straight away go to the medical college?
Yeah, so if you have done MBBS here in India, you
Hmm.
have to give step 1 and step 2 USMLE exams. Then they
Right.
have got 7 years of training in
Yeah.
OBG, in whatever other
Yeah.
subspecialty trainings, or they need training in all other specialties. Then you choose in the end what you are interested.
Yeah.
That is around 7 years specialty trainings.
Yeah.
So that is again 7 years.
Yeah. Yeah.
But you have to clear USMLE step 1 and step 2 after MBBS if you want US.
And how long does it take to clear these exams after MBBS?
I have seen people struggling a lot. So it all depends on how much support you have and how much you are really committed to the books and you can stay and work hard. And also it depends on how sharp you are.
So would you say that it makes more sense to
Uh,
study, to do your pre-med in US and then follow the entire medicine path directly from pre-med to the eventual specialization in US itself, rather than
yes.
doing the MBBS here and then going to
Yes,
US?
yes, yes. I would say that because if you want to settle in US,
Mm,
better to start from first over there
mm,
only. There is no point in doing here MBBS and then going there.
mm,
Because
mm.
if you do the undergraduate there and the pre-med school of 4 years there,
Yeah,
you know the system very well there.
exactly.
So what I want to tell for the parents here is most of us have seen the life abroad and we have come here and we have sent our kids for the schooling here as well. Some are in the local national level program and some have taken up the international syllabus. So if you think you want your child's life to be in US or if your child is interested in settling in US only, better send her from the start after her high school here. Yeah. And if you want UK pathway, shortest pathway, where she does her training over there and
Mm,
then come back to India, or if she wishes to stay over there, she can do there or apply
mm,
for any other European countries as well.
mm,
That is also fine. But one thing is you need to decide which country you are interested in. If US, please start from first. There is
mm,
no point in entering in the middle like
mm,
USMLE step 1 and step 2 because it causes a lot of stress as well for a candidate. And if you want UK, you can also send from after A levels, which is direct
yeah,
entry,
yeah.
which is easier as well.
Mm,
And
mm,
they can finish into training, they enjoy their life. It has
mm,
got a multicultural life in UK. Yeah,
mhm.
you get doctors from the Africa, Nigerian
Yeah.
countries, you get
Yeah.
doctors from Australia, you get doctors from US, you get many doctors from India as well. So if we want to feel like the India, UK
Mm.
is also good as well. Okay.
But the shortest academic training to become a gynae or an obstetrics is to study in India.
Study in India.
Like the shortest academic training to become an obstetrics or a gynae is the path that you can follow in India, right? Uh,
Yeah,
was
yeah. So in India, you have to go to the NET PG exams, apply for MBBS, and then you have to give again NET PG and enter either the specialty you are interested in.
which is
Okay.
how many
Once
years?
again 3 years. So 5 years of MBBS plus 3 years of that post graduation. So that takes up your 8 years.
Yeah.
After that, you will be doing your fellowship exams. Like
Mm,
here in India, the basic OBG training will be given. Okay,
mm,
you can do most of the obstetrics here because the caseload is so good in any of the
mm,
hospital. You will
mm,
be well trained by the
mm,
end of 3 years training in
mm.
OBGYN. Okay,
Okay.
but if you want any subspecialty, then
Mm,
you have to choose some other fellowship route. Like you have to
understood.
do 2 years of infertility, 2 years of laparoscopy,
Mm,
and then work under some senior or a consultant or
mm,
a medical school where you
mm,
can get hands-on training on that subspecialty. Once you get enough hands-on experience, then you
mhm,
can enter the corporate because corporate will look at a doctor who can do
mm,
individually things at the
mm,
consultant level, and
mhm,
also you need to bring that caseload to that hospital, to the corporate. Okay,
mm,
they will see how much patients are coming to you when you enter
mm,
into subspecialty as a consultant. They will
mhm,
see the tick boxes, which doctor is getting more patients, which doctor
mm.
is bringing good profit to my corporate. They will see that.
Okay, so
So
those are the parameters. Mm,
after doing some fellowship, whatever
mhm,
you are doing,
mhm,
better do in a medical college where you get more
mm,
hands-on on that particular subspecialty you are
mm,
doing. And
mm.
then once you are enough confident in handling things, then you can go to the corporate and you can show what skills you have and flourish from there.
So when you say corporate, you mean private hospitals.
Yes, private hospitals. There are
Okay.
many private hospitals, they do hire and all, but if you have not trained and all, coming
Mhm,
here and expecting to give hands-on experience is
mm.
very less. because people are paid in India, especially people are paid and coming to the corporate, and no consultant will take a chance to give a hands-on experience if you are not into the training in that corporate, because many corporates do provide DNB training and all. Okay, if you are into the corporate in that program, they will give you the hands-on experience. But if you have done training elsewhere and expecting some hands-on on the corporate setup,
That won't happen.
no, it's not going to happen. So
Yeah.
you need to be trained well and then come to the corporate and show your skills, what you
Yeah.
have got.
End this podcast by asking you one final question. What advice would you give to a student who is aspiring to build a career in gynecology and obstetrics?
Okay. If you are really interested in OBGYN, I would say please go ahead. It is a really good specialty if you are really interested in. And if you are interested in mother and child care, please go ahead in obstetrics where you can manage both the medical conditions and the obstetric conditions. And if you are a personality where you can handle emergencies, if you are okay to take up night on calls, if you have got good family support till you reach certain stage of your life, then better take OBGYN. This is it's really good specialty. I should say I'm enjoying it. And if you think you're really interested, please go ahead with that specialty. And if you think you are interested only in OBGYN, but you just restricted to do the outpatient department, don't want surgical, you can choose infertility. You can either choose benign gynae and manage the obstetric patients antenatally and then refer later on elsewhere. But patient don't like that when you want to choose that.
Yeah.
Patient wants a doctor who operates as well.
Yeah.
Okay.
Yeah.
And if you are able to manage the long standing hours of surgery and all, you're committed for that, you can choose oncology, which has got 3 to 5, 6 hours of longer surgeries, and a laparoscopy sometimes 2 to 3 hours will take up. And
Great.
if you are a personality where you don't want any stress in your life, you don't want any emergencies, you want to be a doctor, but you want to just 9 to 5 job, you need to take some specialities like a dermatology. You need to take certain specialities like ophthalmology. You need to take certain specialities like family medicine. Yeah, or a ENT doctor also. If they you very rarely you get emergencies, but it is manageable, and you can have good life. And also, last but not the least, but highly in demand, is a radiology branch.
Correct. Correct.
Radiology is the one where you can see the scans. If any emergency opinion comes, for example, on the weekend, you can see the radiology at home also. If they have sent the scans, if you have got that set up, you can see at home and just give an opinion on that. People in UK who are radiologists, they see the scan for second opinion sent from India over there as well.
Okay.
Okay, so radiology is that cool subject. So
Great.
radiology, dermatology, ENT, ophthalmology are really very good. And if you want some paramedicals, you can choose like microbiology and pathology or a biochemistry. These are the paramedics where you want to be a doctor, but you are restricted to the lab aspects. Okay, these are the paramedics. So if you want good personal life and you want a hospital setup, you want to learn the clinical things, paramedics is also the good branch as well. But it all depends on if you're interested in or
Yeah.
not.
Yeah. Where your
But
interest and the aptitude lies.
yes. So my final take-home message I would say is, don't think that this is very stressful. You told me this is stressful. You told me this has got family pressure, personal commitments, and all. Don't worry about all that. Once if you are interested in certain specialty, please go ahead with that specialty. You will rock in that because you will show interest, and attending the emergencies will come just like that. You don't have to make up your mind priorly in order to enter that specialty. If you think you are really interested in that, please go ahead in that.
Great.
If you take up a specialty by looking at this is life is good, this is life is good, and if you don't enjoy that subject,
Yeah.
there is no point in taking that.
Absolutely. That's a fantastic advice. It is so important that your interest as well as your aptitude meet,
Yes,
converge, because that's where
yes,
your real potential lies.
yes.
So, thank you so much, Dr. Manisha. You have
Thank
given
you, thank you.
like so much of valuable information, so many insights out there. I mean, so much
Yeah,
of knowledge for our parent and student community to absorb, assimilate in this field. I mean, this podcast has been quite a revelation for us.
Thank you so much. Can I just add one more thing, if you don't
Sure.
mind?
Absolutely. Please go ahead.
Working in UK and here, after doing the training here, I have seen one thing, that empathy and sympathy
Mm,
is the one lacking towards the patient.
mm,
If you have been trained here as a doctor,
right.
sometimes in the medical schooling or in the training, these
Mhm,
things are not taught here
mm,
so well as it is in UK.
mm,
In UK, when I have gone and attended the first year of my wards or my theater sessions,
mhm.
surgery is not what they see. The first thing they see is how empathetic you are as a doctor, how
Wow.
sympathy you are showing for certain conditions, how are your communication skills with the
Mm,
patient. This is very important. If you think you have excelled these aspects of empathy, sympathy, and communication with the patient,
mm.
you will excel anywhere.
Yeah.
Because you need to speak to a patient from the patient's perspective, not from your perspective, what you want. You
Mm,
need to get into the patient's shoes and feel, how they are going through certain things.
yeah.
Only then you will gain trust with the patient.
That's an excellent advice, an excellent advice that
Yeah.
compassion, which
Yes.
is like a mix of sympathy plus empathy, is so important, so vital to
Yeah.
strike that chord and connect with your patient.
Yes, yes, yes. This is the two thing as a doctor, I would say. Please don't forget and please involve it in your day-to-day practice if you're entering into the medical school. It is
Mm,
very important. And give
great.
time for the patient. Listen to the patient what they are saying rather than you blabbering and telling from your perspective.
Mm.
Listening also is another important thing, I should say, is very important.
Yeah, deep listening is a very pertinent skill, wherein you are listening to understand and not listening just to respond.
Yes, yes, yes.
Great. Thank you so much, Dr. Manisha, for your valuable time. We
Thank you,
greatly
thank you.
appreciate your time and expertise.
Thank
Thank you so
you.
much.
Thank you for having me. Thank you. Good luck.
You were listening to No Herd Mentality Conversations. Please subscribe to our channel for more such in depth conversations on different careers and professions and countries. I'm Ruchika signing off on behalf of No Herd Mentality.